Welcome to the Ottawa-Carleton District School Board Parent Articulation Training video. My name is Jackie Glantz, and I am a speech-language pathologist with the Ottawa-Carleton District School Board. The Parent Articulation Training Program is a resource program for parents, grandparents, caregivers, guardians, and educators. The program is offered in a workshop format several evenings throughout the school year, or alternatively, you can also watch this video. Only the person who has attended a workshop and/or watched this video is trained to implement this program. This program will teach you all the tricks that speech-language pathologists use to remediate your child's articulation errors, and it will only take 3 to 5 minutes a night, 5 times a week. Within 2 weeks, you and your child will rapidly notice the difference. This parent training program is in its 9th year and has successfully trained parents to remediate their child's articulation errors. In fact, the program has been so successful that other school boards and agencies requested the program to enhance their service delivery. You have been asked to watch this video or attend a workshop because your child has been identified by the school speech-language pathologist as having a mild articulation disorder. A mild articulation disorder means that 3 or fewer sounds are affected. The referral may have come from the parent, the classroom teacher, the learning support teacher, or from an outside agency such as a private speech-language pathologist. As you can see from the developmental chart, your child should have developed specific sounds within certain age ranges. Those age ranges are highlighted by the shadowed bars. For example, if your child is 7 years of age and has not yet developed an S sound or a S sound, that is considered to be an error or delayed. In addition, if your child is 9.5 years of age and they have not yet developed a proper R sound or sound, it is considered to be an error or delayed. You can check your child's errors with the developmental chart provided in your packet. When you registered for this program, you received a packet that was individually selected for your child based on the evaluation by the school speech-language pathologist. In addition, you received a pamphlet that outlines the Parent Articulation Training Program. If you have received more than one sound booklet in your packet, the priority of sound remediation is written on the outside of the packet. You are only going to work on one sound at a time. You are going to work on the most stimulable sound first. What does stimulability mean? Stimulability means that your child can easily produce one sound in isolation, and therefore they are ready to learn to produce that sound in words, then sentences, and finally in conversation. They just need a little bit of help. They may have other sound errors, but those may not be developmentally ready just yet. You must always start with the most stimulable sound first, so that your child feels motivated and they feel successful to complete the training program. Remember, the program is only 3 to 5 minutes a night, 5 times a week, and within 2 weeks, you will see a change. Parents always ask, why does my child have an articulation error? The Ottawa-Carleton District School Board speech-language pathologist will evaluate your child's oral motor function and developmental history. For example, they will investigate whether there is a history of middle ear infections, whether your child was a thumb sucker or a soother sucker, whether there are dentition issues, and also if there is a family history. But most commonly, children with articulation errors are unable to self-edit themselves auditorily. They are able to hear the error on others, but not on themselves. For example, if I asked your child to identify a picture of a thumb, they may say, thumb. I would repeat their production back to them and say, thumb, and they would say, no, thumb. They were able to hear the error on me, but not on themselves. They are unable to self-edit auditorily. During this video, I will train your ear so that you in turn can train your child's ear to hear the correct from the incorrect sound production. What is an articulation error? The four most common types of articulation errors can easily be remembered by the acronym SOTA. The S in SOTA stands for substitution. These are the most common types of articulation errors and the easiest to remediate. For example, your child may substitute a W for an R sound. They may say wed for red, cowets for carrots, or caw for car. The O in the acronym SOTA stands for omissions. This is a much more severe type of articulation disorder, and it means that your child is not yet developmentally ready to produce these sounds and they omit them. They completely leave the sound out. For example, if your child has a TH omission, they may say for thumb, toothpaste for toothpaste, and T for teeth. The D in the acronym SOTA stands for distortion. This is often seen in the effects of dentition, and it's where your child may have slushy speech or a lateral lisp. For example, your child may say sun for sun or shoe for shoe. The A in the acronym SOTA stands for addition. This is usually seen in younger children, where they usually add a vowel, and it sounds as if they are singing. You may hear them on the playground, such as this: I want to play with you today. Although it sounds cute, it is actually an articulation error. Remember I said substitution errors are the most common and the easiest to remediate. They fall under the category of a mild articulation disorder. Articulation errors can affect your child's literacy skills, their self-esteem, and their social skills. Your child is often aware of their speech errors. It may inhibit them from speaking out orally in the classroom, from joining in classroom discussions. They may be teased by their peers for the way that they speak. They may also have difficulty with their printing, reading, and writing. For example, on spelling tests, children will often substitute the same sound in terms of the way they say it. They may write the word wed instead of red. The whole reason for the Parent Articulation Training Program is to remediate these sounds early so that your child can be a successful communicator. Remember, this is only a mild difficulty, and they just need a little help from you to develop their articulation skills. As I said, the way a child speaks is often the way they read and the way that they write. We are now ready to open our packages and begin. The two most important areas to focus on are discrimination and imitation. Discrimination is teaching your child to hear the difference between the correct from the incorrect sound. Imitation is teaching them to produce the correct sound by imitating your production. And now you will learn to produce each sound correctly. The sounds that I am going to describe to you are typically the most common errors seen in school-aged children. Sounds often come in pairs and are called minimal pairs, which means that they are made the same way, but one sound is voiced and one is devoiced or quiet. We usually teach the quiet sound first because it is easier and does not add the addition of vibration of vocal cords. For example, the k and the g are minimal pairs. They are made the same way, but the k is the quiet sound and the g is the voice sound. Now, let's begin to learn each sound correctly. Let's start with the k and g sounds, or the k and g sounds. The k is a harder sound because it is a back sound, so it is not visible. The easiest way to teach your child to produce the k sound is to have them flip their head back so that their tongue falls naturally backwards. Gravity helps with the tongue muscle. You can use the back of a spoon or a tongue depressor to help with tongue placement. Or, if your child is younger, they can sit on a chair and flip their head backwards. For example, k, k. Remember, you must always start with the D-voiced or the quiet sound first. The k is the quiet sound. The voice sound is the g. Typically, when you work on the D-voiced or quiet sound first, the voice sound will naturally develop. So remember, the minimal pair is the k and the g. Let's move on to the next two sounds, the f and v, or the f and v. To make an F sound, gently bite on the lower lip with your top teeth and blow. The V sound is made exactly the same. Remember to start with the D-voiced or quiet sound first, as the voice sound will typically and naturally develop on its own in most cases. Remember to prolong and exaggerate the sound so that your child can feel it, see it, and hear it. Let's move on to the next two sounds. Let's move to the S and Z sound, or the S and Z sound. To make a proper S, we always tell the child to take this finger, feel the bump behind their bottom teeth, place their tongue there, close their teeth, and blow straight out. One more time. Take this finger, feel the bump behind the bottom teeth, place your tongue there, close your teeth, and blow straight out. Parents always say, "That is not where I put my tongue. My tongue is in the middle." That's correct. As you've learned to produce an S sound correctly, your tongue may be in the midline position. However, your child is already doing that, and they have an interdontal lisp, or a TH for an S substitution, such as this: fun for sun. Remember to remind them to keep their teeth together. If they have a lateral lisp on their S, when they're producing the S sound, they are smiling. This distorts the S production. Remember again, keep the teeth closed and blow straight out. If during therapy your child has managed to lose their teeth, if they're between the ages of 5 to 7 years of age, and I'm talking particularly about their top 2 and bottom 2 teeth, then you may have to stop therapy and resume once their teeth have grown in. The voice sound to the S sound is the Z sound, or the Z. If at any time your child has not developed the Z or the Z sound naturally, they may have trouble increasing the vibration of their vocal cords. One way of helping with that is to push a table against a wall and have your child push the table. This will increase their oral vibration strength. Remember, always teach the quiet sound first. So you would teach the S prior to teaching the Z. Let's move on to the next two sounds. The next two sounds are the TH sounds, and most people do not know that there are actually two TH sounds. The first TH sound is the quiet or voiceless TH, such as th in thumb. The second TH sound is the voiced TH sound, such as th in the, these, those. To produce the TH sound, teach your child to bite gently on their tongue and blow. The voiced TH sound is made in the exact same way. Remember, always start with the voiceless TH sound first and let your child feel the sound, hear the sound, and see the sound, because this is a visible sound. Now let's move on to the next sound. The next sound is the la sound, or the L sound. Most people produce this sound by curling their tongue up and back. La. However, your child is not able to produce it. They usually substitute a wa or a ya for the la sound. So, the easiest way to teach them to produce the la sound is to have them stick their tongue out a little bit, bite gently, and say la. They may not be able to curl their tongue up and back because they may have a slight tongue tie or their muscles may not yet have developed. The more you practice their sound, eventually the muscle will gradually develop and move the tongue back to the proper position. Let's see that sound again. La. La. The next two sounds are the ch and the j sounds, or the ch and the j sounds. These two sounds require a lot of buildup of intraoral air pressure. To produce these sounds, we tell your child to take a big breath, put their head back, their mouth is open, then they need to close their teeth and push their head forward as if they were sneezing. It sounds complicated, but just watch. Ch. Again. Ch. That is the devoiced or quiet sound. The voice sound is the j sound and is made the exact same way. Watch this. Ja. Ja. The next two sounds are the sh and the zh sounds, or the sh and the zh sounds. The sh sound is made almost the same as an s sound, and oftentimes children will substitute an s for an sh because they have forgotten to pucker their lips. To make the sh or the sh sound, your child's teeth must be together. Their lips must be puckered. They need to take a deep breath and blow. Watch. Shh. Again. Shh. The ZH is the voiced sound and is made the exact same way. Zh. Zh. This is a rare sound and is found in words such as measure and treasure. Let's move on to the last sound. The last sound is the R sound, or the sound. We always teach it as the and not the R sound. There are two ways to teach your child to produce the R sound correctly. The first way is to leave a little space between their teeth, pucker their lips, and say The second way is to teach the R sound in a smile. Clench your teeth and grin. The school speech-language pathologist will have determined what is the easiest and most stimulable way for your child to produce the R sound. R is one of the later developing sounds, and there are many combinations: ER, AR, OR, IOUR. If your child is in French immersion, the R sound is produced differently, and an R difficulty in English may not be noted until your child is older, when there is more of an English component in their school program. At the beginning, all of the sounds need to be exaggerated because your child needs to see the sounds, hear the sounds, feel the sounds, in order for them to produce the sound properly and to discriminate the correct from the incorrect production. It is important for you, the parents, to produce the sound correctly because you are the model for your child at home. Some articulation errors can be genetic, so if you are not sure that you are producing the sound correctly, check with your school speech-language pathologist. Remember, you are the model. Exaggerate it. Use enthusiasm. Motivate your child. You can use a mirror, a tape recorder, or a video camera if you prefer and want to have some extra feedback. Now you know how to make each sound in isolation and the way the speech pathologist will teach your child as well. What is the hierarchy of each sound, or in what order do you teach the sounds first? First, you will teach the sound in isolation, then at the beginning of a vowel, then in the initial position of words, the final position of words, and the medial or middle position of words. The order may vary depending on your child or on the sound, but you always start with the sound at the beginning of words first. Next, you will practice the sound in phrases, sentences, and conversation. The ultimate goal is for your child to be able to produce the sound spontaneously in conversation. Please see your packet for the correct hierarchy of each sound. Let's start with the first step. Look at your sound in isolation chart. This chart is used to practice the sound in isolation. For example, you can say, when I lift my finger, I want you to give me 5 good S or S sounds. Have your child put a check mark in the box provided so that they have the responsibility to hear the correct production of the sound. Remember, you are training them to discriminate or self-edit the correct from the incorrect sound production. Do this 25 times in total, which should only take about 3 minutes. You do not move on until you have achieved 100% accuracy on this task. If your child does not produce a good sound, always say to them, good try or almost, but do not lift your finger up. For example, if they say, s, s, almost, good try, try again, s, 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 then they can put the check mark. Once you have obtained 100% accuracy on the sound in isolation, move on to the next sheet. This is the chart that is called sound in isolation combined with a vowel. For example, if you are working on the or the R sound, the chart illustrates the plus the vowel. So you would say each word one time and have your child imitate it. Ra, ray, ri, ro. Go through the whole list one time. This will only take 30 seconds to 1 minute. Let me illustrate this again with a different sound. If you are working on the S or the S sound, you would say saw. Your child would repeat it. If they did it correctly, they would put a check mark beside the box provided. Really exaggerate the sounds, and again, do not move on until 100% accuracy has been reached. Now you are ready to move on to completing the whole booklet provided. You will start with the sound level, move to the phrase and sentence level, and lastly, the conversation level. The sections are color-coded for your convenience. Work on it 3 to 5 minutes a day, 5 times a week, and within 2 weeks, you will see the difference. If your child is just not getting it, or you feel that something is not quite right, feel free to call or email us or speak with the school speech-language pathologist to set up a time to go over the issue. You can also attend a workshop or watch this video again. When you are done with the sound, the next packet will be mailed to you. Wait a couple of weeks until the sound is consolidated and then call for the packet. Check with your school speech-language pathologist if the child does not seem to be stimulable or ready to produce the next sound. Let's discuss how to set up your home program. Tell your child that you have been to a workshop or watched this training video, and that you have received homework from the speech-language pathologist and that he or she will be checking to ensure that the homework is done. This takes the onus off of you as a parent. It is difficult to be both a parent and a therapist, so we're making it easier for you to complete this task. All the materials that you need are here in the packet. If the child is a teenager, feel free just to use the drill sheets. Sometimes parents would like the classroom teacher to be involved. However, we always ask the child's permission first before involving the teacher. Some children are self-conscious and would not want the teacher involved or other children in the class to know. However, if your child is agreeable to the teacher being involved, we often suggest that the teacher keep an empty glass jar on her desk, and every time she hears your child say the target word correctly, that she place a paperclip in the empty jar. If your child is not stimulable, they are not ready. Sometimes you will need therapy to help the sound develop, or it may naturally develop on its own. Remember, if your child's teeth fall out, stop the program and restart once the child's teeth have grown in and they are used to them. Once you are finished with a sound, wait 2 to 3 weeks before beginning a new sound. This helps consolidate the sound that has just been learned and will establish the sound into the carryover position of conversation, the ultimate goal. Parents also ask if other siblings are around, can they be present in the therapy? This may not be a great idea at the beginning. Remember, other siblings may be able to produce the sound and your child cannot. So once they've learned the sound and feel confident, then the siblings can join. However, leave it up to the articulation disordered child. Parents also ask, what if they miss a night of therapy? Remember, the goal is to work 5 nights a week, 3 to 5 minutes. However, if you are unwell, or you've had a bad day at work, or your child is unwell, it is okay to miss a therapy session. The time and place of the therapy should be consistent and similar to where you and your child already do homework. Some parents like to use the kitchen table, and some parents like to have a captive audience, especially if your children are younger, and they might do the speech work just before story time in bed or while your child is in the bathtub. Do what works best for you and your child. Before you finish watching this video, you must remember the 5 steps of the program. Step 1, know your goal. You have to know which sound you are starting with. Step 2, instructions. Give the simple instructions that you were trained to do in this video. Step 3, prompts. Use physical prompts demonstrated in this video, such as the puckering of the lips for the SH sound. Step 4, remember to use the evaluation sheets enclosed. Step 5, reward. Use whatever reward system you already use in your home. your child needs to be praised for the progress and the work that they have done. Some parents like to use stickers or board games or computer time. Also, parents, you need to reward yourselves for all the work that you have been doing. So if it means dinner out or a night at the movies, feel free to reward yourself for the work you have completed. I've already given you quite a few tips on working with your child, and I'm just going to add a few more. You must motivate your child, and we know that you will because you have taken the time to either attend a workshop and/or watch this video. If you find that your child is frustrated, it is okay to stop. Also, do not worry about the non-therapy times. It is perfectly natural for your child to produce the sound correctly in your 3 to 5 minutes of therapy and then walk away and have an articulation error. For example, if you're working on the S sound, your child may be able to produce them all correctly during your 3 to 5 minutes of therapy, walk to the window and say, "Oh look, the sun is shining." That is normal because they are so focused on the correct sound production during the therapy time. They eventually will learn to produce that sound when you reach the sentence and conversation level. Do not work on any other sound except your target sound, particularly if your child has more than one sound error. Parents often ask about private therapy. Articulation therapy should not last longer than 30 minutes. In addition, if you follow this program, you should be able to do it all without private therapy. However, if you do pursue private therapy, remember it is usually only one session per week and you will still have to practice daily. Now, let's review what we have learned in this video. First of all, start with the sound in isolation. Once you have achieved 100% accuracy, which you will easily do within 1 to 2 days, because remember, your child was most stimulable on this sound, you can then move on to the sound at the beginning of a vowel. Again, you need to achieve 100% accuracy before moving on to the sound at the beginning of words. As you are going through the word level, always try to achieve 90 to 100% accuracy. Typically, a sound will take 2 weeks to 2 months to develop, except for the R sound, which can take up to 6 months to complete, as the R sound in the final position has many variations. Once you are in sentence and conversational level, then you may start correcting your child's errors in everyday speech. Make some mistakes. It's fun for your child to correct you. They do like to be right once in a while. Now, let us review the sounds of final time. My colleague, Debbie Maniloff, also a speech-language pathologist with the Ottawa-Carleton District School Board, will now show you the sounds of final time.
Now let's review the methods for making each of the sounds. For the K sound, tilt your head back, letting your tongue fall back. Then bring your head forward, saying K. For the G sound, tilt your head back, letting your tongue fall back. Then bring your head forward, saying G. For the F sound, place your top teeth on your lower lip. Bite gently and blow, saying F. For the V sound, place your top teeth on your lower lip. Bite gently and say V. For the S sound, place your tongue on the bump behind your lower teeth. Close your teeth and blow straight out, saying S. For the Z sound, place your tongue on the bump behind your lower teeth. Close your teeth and blow straight out, saying Z. For the TH sound, place your tongue between your teeth. Bite gently and blow, saying F or V. For the L sound, place your tongue between your teeth. Bite gently and say La. For the CH sound, take a deep breath, tilt your head back, close your teeth, and then bring your head forward quickly, like you are sneezing, saying ch. For the J sound, take a deep breath, tilt your head back, close your teeth, and then bring your head forward quickly, like you are sneezing, saying j. For the SH sound, pucker your lips, close your teeth, and blow straight out, saying shh. For the ZH sound, pucker your lips, close your teeth, and blow straight out, saying zh. And finally, for the R sound, there are two methods. For the first, make a space between your teeth using your finger. Pucker your lips and say And for the second method, close your teeth. Spread your lips in a wide smile, saying And there you have it, the methods for making each of the sounds.
Thank you, Debbie. If at any time you have questions, feel free to call us on the Pat P hotline. If your child attends an OCDSB school and you need another sound package, then just leave us your name, phone number, your child's name, and school that they attend so that the package can be mailed directly to your child's school. If you need a demonstration therapy session, you can see us here at the board office. Or if you prefer to go to your child's school, then make the arrangements with your school speech-language pathologist. If you live outside the Ottawa-Carleton District School Board, then contact the local agency that shared this video with you. I know that you'll be successful as you've taken the time to either attend a workshop or watch this video, and because you want to help your child become a functional, successful, and independent communicator. Thank you for watching this parent articulation training video presentation, and good luck with the program.